Good evening and welcome to our Wednesday Wellness June edition. Dr. Pollak, are you ready to get started?
I am.
Awesome. Okay, I just have a couple housekeeping items first, and then we will kick this off. So just so all the participants know, you are muted and your video is turned off. If you'd like to ask a question, Dr. Pollak will answer questions at the end of her presentation. You'll see a Q&A icon in the bottom of your Zoom window. So go ahead and click in there and type your question in, and we'll be happy to look at them at the end of the presentation. Please don't type them in the chat. In the coming days, you'll receive an email with a link to the presentation recording as well as the slides. And then we will also share any other resources Dr. Pollak speaks to in the presentation. So this evening, again, we have Pediatrician Aimee Pollak, and she will present advice and tips for talking to your adolescent about puberty. So take it away, Dr. Pollak.
All right. Good evening, everyone. So again, like she said, I am Dr. Pollak. I work over at Trinity IHA Medical Group Orchard Pediatrics out in Farmington Hills. And today I'm going to talk to you about puberty and talking to your adolescent. As far as goals, we're going to kind of do a brief overview of puberty, and then we'll dive deeper into the specific changes and events that we see during puberty. And during this, we'll talk about some tips and tricks for talking to your children and adolescents. I'm going to bring in some basic science information. I'm going to bring in some clinical things that I've seen in my own experience. And then again, I'm happy to address any questions at the end. So just to begin, puberty, the basics. So puberty, we all know, is the period of time during adolescence where the body develops into adulthood. And when we talk about puberty and we think about puberty, a lot of us tend to think about the physical changes. And we're going to talk a lot about the physical changes today. But it's important to remember that during this time, adolescents are going a ton of cognitive and psychosocial maturation. And so on top of addressing the physical things that they're experiencing, we also have to keep in mind that their interactions and their thought processes are changing at the same time. And with that, when we talk about discussing puberty with your child, of course, as I said, we're talking about discussing the physical changes. When we talk about the physical changes, we have to explain the why, the how, as well as personal hygiene, how to prepare yourself for these changes that are coming. We also have to talk to them about the emotional changes, their healthy lifestyle, having healthy and supportive relationships with their peer and family members, and then how to keep themselves safe. So the physical changes are enough to overwhelm any adolescent. For males, things that we typically see, we see the adolescent growth spurt. They tend to have changes in their genitalia, so they get testicular and penile enlargement, hair growth, deepening of the voice, acne, body odor. They get a change in their body habitus so that they have increased muscularity. And then a lot of males will talk about experience gynecomastia, which is some enlargement of the breast tissue. Females, a lot of the same things on the list. They have their growth spurt, some hair growth, acne, and body odor. But when we talk about female pubertal changes, we're also looking at breast development and menstruation. And so as you can see, lots of changes physically going on during puberty, as well as those emotional and social ones that we talked about. So it's really important to stay on top of it, have frequent conversations with your child, adolescent, teenager, and make sure to help them navigate all these changes, because it can be a pretty anxiety provoking and unsure time for them. So just the basics, why is this happening? There's two systems in our body that cause the changes, the physical changes that we see during puberty. The first thing is gonadarchy, is what we refer to that as, but that's basically coming from the brain or the central nervous system. What happens is the hypothalamus in the brain is the ultimate trigger, but it does cause changes in the hormones that are secreted by the pituitary. And these hormones are what leads to the hormone production in the testes and the ovaries, the testosterone and the estradiol that we frequently talk about. Once those changes happen in the hormonal secretion by the gonads, that's when we start to see all those pubertal changes that we were seeing on the previous slide. Separate from that, adrenarche, so this is the adrenal glands start to kick in during puberty too, and they start to make some hormones of their own. They're similar hormones to testosterone, but somewhat less potent. And this results in a lot of the things like the facial hair, the acne, the body odor. And these two things are going on simultaneously, causing the changes that we see during puberty. The four things we tend to talk about are four of the main things we talk about. Telarchy, that's the appearance of breast tissue. Menarche, so that's the first menstrual bleed in females. Spermarchy is the first onset of sperm production in males. And pubarchy, and that's the production or the like pubic hair and the other things that we see with the adrenal cortex kicking in, like I said before. So that's like your hair development, body odor, acne, and those kind of changes. So how do you talk about this with your child? So the biggest thing I want to know, one size does not fit all. You know your child best. You have a sense of how to approach this, what's going to work best with them, but just some general tips and tricks. The biggest thing I would say is to be open for the little chats and the little discussions. Whenever your child, even at a young age, comes up to you with questions about their bodies or questions about other bodies, it's really important to take advantage of those opportunities to answer their questions. Of course, age-appropriate responses are what we're looking for, and to always make sure that even from a young age, we're using the correct terminology for body parts. In 2022, we're essentially a society on hyperspeed. Kids, they're learning information from social media, from the internet, from friends, from peer-to-peer interactions. And so a lot of times with the discussion, a good thing to say when your child approaches you and asks you a question is something along the lines of, well, what do you know about that? Or what have you heard about that? Do you have any thoughts about that? Because a lot of times they might actually already have they might have more knowledge than we think, or some preconceived notions that will kind of help to guide the conversation. There's lots of resources available to help parents discuss puberty with their child. A lot of people will have books that they'll share with their children. My biggest advice, or one of my pieces of advice that I give families in clinic, is that anytime you're going to offer your child a book or any other kind of resource about something as sensitive as puberty, sexual intercourse, things like that, is really make sure that you review the book first, that it's appropriate information, that it's correct information, and that it's information that fits along kind of with your family's beliefs. On the next slide, I'm going to give a list of a bunch of books. A lot of times they're specific to males and females, although most of the books do have a section dedicated to the other, to either male or female. Journaling I put on here because, like I said, one size does not fit all. Some kids are happy to chat all the time. Some kids are open for discussion. We all know lots of kids are shy around this topic, and this can be a difficult topic to talk about. So in reference to journaling, one thing that I've had families try that has been helpful is to actually have a journal available, so that if a child, if they're either reading a book or they're just hearing things out in the world, they can kind of write a quick question and put it at their bedside or have a designated place that they can put it. That way you can approach them and give them a specific answer, because sometimes it's easier if they don't have to initiate that conversation verbally, but can initiate that conversation on paper. A similar thing to that is a lot of families will, provide a book for their child. And I've had families put Post-its in it. So let's say their daughter's reading a book and it starts to talk about menstruation and they have questions. They can put a little Post-it note in there, put it in that designated space for mom or dad to see it. And then that way the parents know, they have questions about this, and they can approach them and initiate that conversation for them. Also, it's always good to be able to read the book with your child. That way you can answer questions in the heat of the moment. Websites, there are a lot of very good websites out there. There are also a lot of very not okay websites out there. And so I'll give you a list of websites that I tend to recommend for my families that talk about pubertal changes and growing up. But I always say, again, much like the books, where it's really important that you read the books ahead of time and know that the information is age appropriate and fits with your family values. Very much so that you need to review the websites before these kiddos are going on it. And then a lot of schools still do school-based education. I know many of the schools will actually send a link out to families before so that they can, review the material that's going to be covered. This is helpful because then you're able to discuss it with your kiddo either ahead of time or after the fact, answer any questions they have. If not, I mean, most of us, we do have to sign a little slip saying that we're okay with our kid participating in this component of their education. Make sure that if you know that they're having education in school, that when they come home, that you talk about it with them. Open-ended questions are always great again. So what did you learn about today? Is there anything that worries you about what you learned today? Do you have questions about what you learned today? Again, because they either A, may have misunderstood something, B, maybe there was some chat around the playground after and they got incorrect information or incorrect answers. And then they might have lingering questions that they just weren't comfortable asking in front of their peers. So always important that, you're involved in the education so that they're getting the correct information. So here's some of the common books. The Care and Keeping of You. I have the girls on the left side. The Care and Keeping of You, that is the American Girl doll book. That's probably the most popular one that I see being used. There's two parts, one for younger kiddos, one for older kiddos. Other books for girls, the What's Happening to My Body book, specifically the book for girls. Growing Up, It's a Girl Thing. And On Your Mark, It's Set, Grow, a What's Happening to My Body book for younger girls. Again, with these books, the primary information is regarding puberty in girls, but they'll also have brief sections to explain what's going on in their boy or male counterparts. And then as far as books for boys, Guy Stuff, the Body book, the What's Happening to My Body book for boys, so same as the girls, but for the boys. What's Going down there, Boys Guide to Growing Up. The Boys Body book, American Medical Association's Boys Guide to Becoming a Team. And On Your Mark, It's Set, Grow, a What's Happening to My Body book for younger boys. Again, there's lots of books out there. One size does not fit all. So you want to pick one, review one that you think is appropriate for your child. And then either, read it with them, give it to them. But if they're going to read it on their own, again, I think it's important that you do frequent check-ins as far as, hey, have you looked at your book recently? Is there anything that you learned? Do you have any questions? Just make sure that you're being part of the education rather than just providing the book. As far as websites, healthychildren.org. So that's an American Academy of Pediatric website. They do have a section on puberty. That's actually the healthychildren.org is a website that I recommend to families in general in my clinic because they have a lot of information about safety. They have a lot of information about growth development. So it's a really good resource for pretty much everything pediatric. But specifically for this talk, they have a good section on puberty and what to expect. Kidshealth.org is another great one. And then girlshealth.gov is another one that I really like. It's a very comprehensive website. So while yes, it does talk into pubertal development, changes with aging, it really goes into a lot of important information. So it talks about nutrition, it talks about fitness, it talks about how do I keep myself safe? How do I make sure that I have positive peer relationships and a positive self-image? What do I do if I'm being bullied? And even has information as far as, environmental exposures, safety, risk-taking behavior. And so that's a really good one to look at with your kiddo and to have as a resource. So when is it my turn? So again, as far as when to have the talk, earliest is best. So even young children, 6, 7, 8 are coming up to you with questions about their body. Again, you're going to want to provide age appropriate explanations, but from the very, very beginning, getting kiddos comfortable with talking about their body parts, getting kiddos comfortable, trying to figure out what they're experiencing and their questions. But as far as puberty, kiddos will start to ask questions, and then there's always the concern, the early bloomers versus the late bloomers. We all went through middle school. There's the kids that enter puberty early. They tend to have their growth spurt early. They tend to be tall early. They tend to have, secondary sexual characteristics early. And this can cause a lot of anxiety for the early bloomers, or a lot of stress for them, just because they're going through this without their peers, and they're wondering, why is it happening to them so soon? But on the other end of the spectrum, there's also the late bloomers. So these are your kiddos that are getting into almost high school and just starting to show, their growth spurt, their pubertal changes. They're on the smaller end of the spectrum as far as height. And that can be stressful for kids too. Why am I not experiencing these things that all my other peers are experiencing? Reassurance is key during this. It's not a race. Everybody, everyone develops at their own time. Everybody develops when it's healthy for their body to develop. And just knowing that average is around 10.5 in females and 11.5 in males. But again, everybody's going to do it kind of at their own time, and reassuring both the early bloomers and the late bloomers. So in regards, like I said, 10.5 for girls, 11.5 for boys. So boys tend to be a little bit later when they enter puberty, but it's a range. So the average, I did boys first on this slide, but the average age for boys to start to undergo puberty is about 10 to 13 years of age. We're going to go through the specifics of what we see, but the first sign in boys is testicular enlargement. Now, 10 to 13 is the kind of that average range, but we, premature, so where we really start to think puberty is happening earlier than we would want is before age 9, and delayed, where we're thinking kind of later than we would want as physicians, is after 14. Girls, you notice just a little bit earlier, so 9 to 12 is average. The first sign that we see in females is the breast development, and earlier premature is considered before 8, delayed is after 13. And this is one of the reasons I stress it's really important to be monitoring your kids, to be bringing your kiddos in for their annual wellness visits, because this is something that we'll talk about with them too. Are you noticing any changes in your body? Do you have any questions about the changes in your body? And if we start to notice some of these changes before 9 in boys or 8 in girls, or the other end where they're delayed, then we'll know that, maybe this is something that we either need to or don't need to look into further. But it is one of the benefits of coming in for their wellness checks. All right, so I decided to start with the things that we see in both males and females together, and then we'll break down kind of those individual pubertal findings that we find in females and then males. So males and females, things that are common to both. Everyone has a growth spurt during puberty. Everyone develops acne during puberty, and changes in hair growth patterns during puberty. And so again, it's important to, talk to them hopefully before these changes happen, so they know what to expect. Talk to them as these changes happen, so they know that it's normal, and reassure them and tell them, what do we need to do with these changes? How do we take care of our body as our body changes? So the growth spurt, if you look at that picture off to the right, that's from that healthychildren.org website. Every child, again, like I said, enters puberty kind of at their own timing. And so the kiddos that enter the puberty and that growth spurt earlier tend to be the taller kids. Shorter kids tend to enter puberty later. And so this is kind of a time where we see that big variation in height, and that can actually be stressful for some kids. Why am I the shortest? Why am I the tallest? There is a lot of growing that happens during puberty. About 20% of adult height happens during puberty. And again, puberty tends to happen earlier in girls. And so what we see before puberty, kiddos tend to grow at a rate of about 3 to 8 centimeters per year. Really about 5 centimeters per year is what we're looking for as pediatricians. During puberty, the rate at which they grow really accelerates. So girls start to go up to about 9 centimeters a year average, and boys 10.3 centimeters a year average. So this explains why in general in the population, males tend to be taller than females. They enter puberty later. And so the amount of time they have to grow before puberty, because ultimately as puberty ends, we eventually stop growing. So the amount of time they have to grow that 5 centimeters per year is longer. And then when they actually increase their growth velocity, that growth velocity is higher. And as far as how the growth happens, limbs tend to grow before the trunk. And so that's where some of these expressions like he's all arms and legs, he's all hands and feet come from. And we can see this sometimes in kids that are active in sports. Sometimes that kind of rapid growth in the extremities before the trunk may affect performance a little bit. And so that can be frustrated and take a little time to get used to. During these growth spurts, that sometimes when we hear things like growing pains, these tend to be pains, in the lower extremities, They tend to happen in the evening. They tend to be bilateral, so they're affecting both sides. And the best thing to do for this is heat, massage. Occasionally, if it's severe enough, we can say a little bit of Motrin. But common as we grow to get those growing pains, as long as kids are otherwise healthy, it's not limiting their activity, it's not waking them up in the middle of the night. We need to reassure them that this is a normal finding, this is just our body growing, and that this will improve over time. So after the growth spurt, the next thing that we see in both males and females is acne. And this can be very distressing for the adolescent population. They're at an age where they're very aware of themselves. They're very self-conscious about what other people think about them. And so having visible acne can be quite distressing. So what causes it? Increased keratin, so that's the outer skin cell layer on our skin. And then as those hormones really kick in, we start to get both an increased number of the sweat glands and an increased sweat and oil production within those sweat glands. Bacteria love that. So bacteria that live in the skin take advantage of that increased oil production and start to proliferate and grow more. And occasionally, or most of the time, there's some inflammation that's caused by the body responding to that increased bacteria. And so all those things together that are triggered by the hormonal changes can result in acne. Things that can exacerbate it: repetitive trauma. So this is why we always say, don't pick your pimples, don't pop your pimples, don't scratch your face. Kids that constantly have their hands on their face like that. Repetitive trauma can exacerbate acne. Stress can, and then insulin resistance can. So kind of with those high glycemic index diets have been shown to increase acne. Chocolate, when I looked at multiple resources, does not increase acne. So that's always good to know. So acne can present in multiple places. Face, neck, trunk can present on the chest, the back, the upper extremities. And again, I mean, those are all areas that are exposed. So it makes kids really, really self-conscious about it. And so again, reassuring them, this is a normal part of puberty. It will get better as you get older, and telling them how to take care of their skin. So essential skincare. It is important to wash your face every day or twice a day. And you want to make sure you're using a soap or a facial cleanser. There's there's shelves and shelves and shelves of this when you go to the pharmacy, but basically making sure benzoyl peroxide is the product that tends to be super effective at fighting acne, and making sure non-comedogenic products for anything you use. So that means that it's not going to be a product that triggers acne or exacerbates acne. And so that's if you're doing lotions, females that choose, or girls that choose to wear makeup, things like that. When you're washing, you want to make sure you moisturize dry areas. So again, with a non-comedogenic product, and then avoid picking, because like we said, inflammation and bacteria are a big part of it. And as you start to spread that around, you can lead to, the mechanical trauma can exacerbate acne, but can also, if you're constantly picking and scratching, lead to scarring. Finally, the last thing that I put for comment for both males and females is armpit care. With the hormones, the increased hormones, we tend to have increased sweat. So when this sweat mixes with bacteria that is known to be on the skin and the armpits, it tends to cause body odor. And so it's really, as far as how to prevent body odor, kids will be really self-conscious with body odor, making sure that you shower regularly and that you're washing your armpits. That way you can get rid of that bacteria. And for sweating, it's okay to have your kiddo use a deodorant or an antiperspirant. And with armpit care, there's also underarm hair. And we'll talk about that a little more as we go into males and females. These pictures that I had on the slides for the last couple, that's from the Care and Keeping of You. So that's the American Girl Doll book that they have both 1 and 2, the older and the younger kids version for females. So specific to females, things that we see during puberty: breast development, changes in hair growth pattern. We'll talk about leukorrhea, so that's the vaginal discharge that girls can experience, and then menstruation. So looking at kind of the timing of everything. So this is a graph from Up to Date. So that's a medical website that we like to use in pediatrics. You'll see that initial blue to red area, so that's the initial breast development. And that's the first thing we tend to see in females as they start to go through puberty. After we start to see that breast development begin, that's when that height velocity or the growth really starts to pick up. And that peaks at about between 11 and 12. and then starts to go down. Shortly after that peak growth, that's when we see menarche. So that's the first period or the onset of menses. And as that's happening, kind of that growth rate slows down. And eventually, on average, puberty is completed somewhere between that 13 and a half, 14 and a half age. So telarchy, that's the fancy word for breast development. Again, for most girls, this is the first sign of puberty. We had kind of talked about how there's those two ongoing processes. There's that one that's going from the brain down to the testes and ovaries, and there's that one going down to the adrenal cortex. For about 15% of females, that adrenal cortex kicks in first. And so we'll start to see some of the things like acne, body odor, and those signs first. But for most girls, telarchy or breast development will be the first thing that we see. Average age is 9 to 12. And, really reassuring during this time. Girls may notice that there's some tenderness, and that's completely normal. We need to reassure them. Asymmetry is normal. A lot of girls will get really, really panicked about that, but to be asymmetric during breast development and as a woman is completely normal. Inverted nipples might be noticed. Again, normal variant, reassurance, and having a little bit of hair is normal too. And then the question that a lot of families will ask me is like, well, we're starting to notice breast development. When do we go shopping for bras? So we'll talk about that a little bit. This is just a diagram. So basically Tanner and Marshall, they're two people who published kind of a staging for breast development. They also have staging for development of pubic hair, testicular growth, penile growth, that kind of stuff. But this is how we monitor breast development in clinic. And so again, important to have the regular checkup so that we can make sure things are progressing as expected in the time expected. So bra shopping, when is the right time? There is no right time is what I tell families. It is all, it's kind of the one size does not fit all thing again. It's dependent on the individual. Some girls, as soon as they start to have breast development, will become self-conscious and they'll want to start wearing a bra right away. Some girls don't. Some girls find them uncomfortable. They're not self-conscious and they don't want to jump to that right away. Sometimes during activities, if girls find themselves more comfortable wearing a bra during activities, that's a sign to go shopping too. And it's important, as a girl's developing, that she goes to the store with someone she knows and someone she trusts and, someone that she can have good conversations with, because there's a lot of bras out there. There's training bras, there's sports bras, there's kind of your regular bras, different fits, different fabrics, different colors, different styles. And so I usually recommend going somewhere where they're going to have a good variety with a close family member or friend, and then trying them on. With females, obviously there's changes in hair development. The hair will develop hair under the armpits, hair in the pubic area, completely normal. Reassuring is important. And also noticing increased hair growth on the arms and legs. So this is a time when we're noticing that, or before we notice that, to have a conversation that, again, this is normal. And then, decide to shave or not to shave. Again, that's not a one size fits all. It's a personal preference. Some girls, if they choose to shave, I always tell families it's very, very important that you counsel them how to do it and that you're there with them the first couple of times that they do it, only because there are the risks of cutting and hurting themselves unintentionally when they're doing it. Leukorrhea. So what is this? This is a clear white kind of sticky vaginal discharge that girls will begin to notice usually about 6 months before they start their period. It can occasionally have a slight smell to it, but a lot of this is a change for a lot of girls, and so they can be very anxious by this. Or so important that they know that this is going to be something that happens. The discharge is basically, it's a liquid that's produced by the vagina to keep itself clean. And so again, if we start to notice these changes, or before we notice these changes, reassuring them that this is completely normal. This is why our bodies do this. And the best thing that we can do is to make sure that we change our underwear every day, we take showers every day, and that we wear cotton underwear. And then the big topic for females is menstruation, first period. So the average age of menarche in the US is about 12 and a half. So we're seeing puberty over time kind of decrease in age to the point where, like I said before, premature puberty, or breast development is the first sign in a female, is under 8 years of age. The rate at which that has decreased is much more rapid than the rate at which menstruation has decreased in age for girls. And typically, as far as like when to anticipate it as a parent, usually it's about 2 to 2.5 years after you first start to notice breast development, or about 6 months after that leukorrhea we were talking about on the last slide. So this is very stressful for females as they grow up. So we need to reassure them. Again, everyone starts when their body is ready. There tends to be a lot of stress about, 10 or 12 of my friends have started their period and I haven't, or I started mine and none of my friends have. And so being kind of on the ends of that spectrum can be very distressing for a lot of females, and just reassuring them that it'll happen when your body's ready. And they're a sign, so they're a sign that your body, it's healthy, it's working properly. And this is what's supposed to happen as we get older. A big stressor that we'll talk about later too is, well, when is it going to happen? Where is it going to happen? Who am I going to be with when it's going to happen? And unfortunately, there really is no great way to know. So, reassuring, the biggest fear that I see from kids in clinic is, am I going to be at school and surrounded by my friends? And so we'll talk more, but, the biggest thing is, nobody has to know when it happens. That first period, people worry, well, will they see it? Usually that first onset is pretty light. And so you can reassure them that it's not something where they're going to stain their clothes and people are going to notice. And then again, we'll talk about more, but just being prepared for this. And female, they'll ask, well, why do we even have periods? And it's your body practicing to have a baby. And so one way I've learned to explain this to patients is it's kind of like a bird in a nest. So every spring, every summer, mama bird will come and she'll gather straw and she'll put together this nice nest for her eggs when it's time for her to have a baby. And that nest will provide a nice, safe environment for those eggs to grow until they're ready to hatch and come out into the world. And I think it provides a nice visual, because then if you look at the female anatomy and the uterus, that kind of, you can explain that, well, the uterus, not every spring, summer, but every month, that endometrial tissue, which is the lining on the inside of your uterus, builds up. And the goal of that is that when you're ready to have a baby and a baby's ready to grow inside that uterus, there's a nice, safe, healthy environment that can provide, the safety and the nutrients that it needs. So much like the nest, if it doesn't get used or when it's done being used, or if it doesn't get used in the spring or summer, it just kind of essentially goes away. But same thing, if the uterine lining is built up at the end of the month and it's not used, then we go ahead and shed that extra lining so we can prepare for next month. And I explain that, and that's blood and tissue, and it comes out the vagina. And that's a completely normal process, getting your body ready for having a baby. So important parts: have the talk and be prepared. So, when your kiddo starts showing signs of puberty, have the talk. This is what happens to females as they get older. Have supplies on hand. So really unscented tampons or pad or what's best. And talk to your kid about what do you think you want to use, and go shopping for the different products. There's different kits you can get online for my first period and stuff now, and have brought to the house. But just having it is not enough. Really practicing using it. The more knowledge is power. So the more you know in that moment, the less stressful it's going to be for the kiddo. So, practice actually putting a padding lighter or a pad inside of your underwear, and know that this is how it works. We don't really say practice inserting tampons before you have your period, but, kind of having tampons and demoing, like, this is what it looks like. This is how it would be used. And even how to dispose of it, kind of walking through every step of the process, so that if you're not there when this happens for her, she has the information that she needs, so that she feels prepared and less anxious. Again, keeping supplies on hand. So, that doesn't mean just having them at home, maybe having a little kid in her backpack if she's going off to summer camp, just making sure that, if we anticipate the time is coming, that she has the supplies that she needs. And then again, the biggest stressor I hear from kids is, well, what if it happens at school? They need to know schools, at the upper elementary, middle school, high school level, they deal with this all the time. So reassure them that, this has happened to many kids before. The teachers and the school nurses and the school staff know exactly how to help them out, and that they do have supplies. So, let's say that for whatever reason, you took the pads out of your backpack and you don't have one with you that day. That's okay. They keep them on hand at school. So don't panic. And that, if it does happen when you're at school, camp, similar situation, reach out to a teacher, reach out to the nurse, reach out to a counselor, let them know, and give them the words that they need to know. So, if they're comfortable, going up to a teacher and saying, I just started my period, or I need help, I just started my period, then fine. Other things that they can use if they're not comfortable saying the word period, because a lot of kiddos are, I have a girl issue, can I go get help, or something like that. So just making sure that not only do they have the supplies, not only are they prepared and know how to use them, but also that they have the words that they are going to use at that moment. And then just what to expect. So typically 2 to 8 days, it's going to be heaviest in the beginning and then get lighter. They let them know that, a day or two after the period seems to have stopped, to make sure that you're still using the supplies to prevent, just in case there is still a little bit of bleeding. And that it's a good idea from the get-go to keep track on an app or a calendar, however, technology, not technology, just to know. Shouldn't be stressed. I always like to tell families, for the first year or two, it is not abnormal to be abnormal in your cycles. So even though we say keep track of it so that we know, if you're noticing that things aren't entirely regular, that's okay. And then for future periods, or even with that first period, what are some of the things that we see? Premenstrual symptoms. A lot of women will have tender breasts, a little bit of cramping in the abdomen. You might notice some increased emotion. So maybe a little bit more moody, maybe a little bit more tired, bloating. Some people will say that, like back pain, nausea, a little bit of diarrhea with the prostaglandin. So these are all normal. Talk about how to make yourself feel better. So kind of some warm pads on the abdomen, warm baths to relax the muscles, make sure you're eating healthy, you're getting plenty of exercise. There are some ibuprofen, Aleve, something like that can help alleviate if the symptoms are severe enough. And if it seems really out of proportion to normal, then make sure you talk to your pediatrician or your doctor, just because we can evaluate to make sure that there's nothing else going on, and B, there are some kids that do need some stronger ibuprofen, basically stronger NSAIDs to help them with their symptoms. All right, so as far as males, again, growth spurt, acne, body odor, the things that we talked about when we talked about both. But other things that they're experiencing during puberty, so they're going to notice changes in their genitalia. So penile, testicular, scrotal changes. Their facial hair, voice changes can be very distressing for adolescent males. And like I said, gynecomastia, is that fancy word for breast tissue development, is normal in males. So the sequence, key points from this graph, this is again from the UpToDate website. You see that things are starting later in males on average. So we're looking at that red line at about 11.5 years of age. The first thing we're going to tend to see is testicular enlargement, followed by right after that, you can see the growth velocity starts to increase. That peaks around 13.5 and then starts to go down. And right after that peak, when they're growing at their peak velocity, is when they start to be able to make sperm, and we start to see a lot of the other signs of puberty. So genital changes. So again, the first thing we usually see with males during puberty is an increase in testicular volume or testicular enlargement. As this happens, the skin of the scrotum, it will get larger and it will tend to darken. And with these changes, the penis will start to grow. The tool, or the picture I have off to the right, that's something called a Prater orchiometer. This really isn't something that we use in general pediatrics all that much. It's more of like an endocrinology tool, or the hormone doctors. But you'll see this in a lot of the textbooks that we have for or not the textbooks, the books that we have for males to read during puberty. And it basically shows how those testicles increase in size. One concern that's came up for me in clinic is make sure that this is known to be a gradual process, as some kids will worry that this is a sudden change in testicular volume, and that can cause a lot of anxiety. Erections. So Boys can get erections throughout their whole life. They actually start within the 3rd trimester of a pregnancy. Erections just tend to happen more during puberty. About a year after testicular enlargement, we start to notice an increase in erection frequency. And the important thing to know is that they can be completely unprovoked. So there doesn't need to be any kind of physical stimulation. There doesn't need to be any kind of emotional stimulation. They can just happen at any time for no reason at all. And this can be very stressful for adolescent males. So just what happens when a male has an erection, the penis, it contains a lot of like spongy tissue in it, and a lot of blood vessels. So when a male's having an erection, those blood vessels basically dilate, which means they can bring more blood into the penis, and that spongy tissue starts to swell up. When it swells up, it starts to block the flow of blood outside or going out of the penis because it blocks the veins. And so basically there's an increase in blood volume, causes swelling of the spongy tissue, and that's what causes the erection. Reassurance. So again, we tend to see an increase in frequency about a year after testicular enlargement. It's completely normal for them to be unpredictable. It's completely, unfortunately, abnormal for them to happen in unopportune times. So the biggest thing is remember not to panic. Reassure the boy. You know, most people aren't really looking in that area most of the time. So, you know, while this may seem embarrassing, most of the time, or really a lot of people aren't going to notice. And you can talk about different things. So make sure you don't stress, make sure that you distract yourself, cover up. So if they're at school and they have a textbook, they have a sweater, some way to cover up to make them feel more socially comfortable. And at the same time, nocturnal emissions will be starting. So that is erection and ejaculation during sleep. And so again, important, this can be rather distressing and sometimes embarrassing for adolescent males. And so having a plan, you know, if you've talked about this ahead of time and they may anticipate that this may happen, you know, maybe they can have a plan. I have a lot of boys that will kind of pull their sheets and put them in the laundry. That way they don't have to verbally approach and say that this happened and that they need new sheets. And so explaining to them what happens during ejaculation, basically, like I said, you know, after that peak growth velocity, males will be able to make sperm. And that what happens is that the sperm is made within the testicle. And then it's actually stored at another part of the genitourinary part that's called the epididymis. And what happens is that when a male ejaculates, so it's a release of fluid, it contains both the sperm that was made by the testicle, as well as some fluid that was made in the prostate. Facial hair, so this again will start to be noticed usually later in puberty. So usually, you know, 14 and 16 is where we start to develop like true noticeable facial hair. Tends to start in the corners of the outer lip, and then gradually that mustache area fills in. Again, the question becomes to shave or not to shave. And this is another one of those not one size fits all answers. But same as I would say with female shaving, you know, make sure that, you know, the first couple of times that there's really good instruction and observation when they're doing it to avoid any kind of injury. Males, they'll start to notice some changes in their voice. It's very gradually. Basically what's happening is their larynx or their voice box is increasing in size. And this, as this happens, the vocal cords have to grow in length and thickness. It's a very gradual process and takes time. So during this, as the vocal cords are adjusting, there will be lots of cracking, lots of squeaking in their voice, and it is pretty much impossible or difficult for a voice to control. So just reassurance, this is a completely normal thing. It will get better with time. And just making sure, you know, I always tell boys, just keep talking. You know, you're probably noticing and focusing on more than those around you. But it is hard, you know, it is a difficult thing for them to experience socially. And as this larynx grows, that's where we start to see the Adam's apple that we see in males. Gynecomastia, so this, I've mentioned this a couple of times now. So that's enlargement of the breast tissue, and it can occur in males during puberty. They do get some conversion to estrogen type of hormones, and it can be unilateral, it can be bilateral. Tends to regress on its own. And so, you know, about 70% will resolve within a year, most resolve within 2 years. and just lots of reassurance. I do always, if I have significant gynecomastia in a male patient, I'll look, are there other things? Because there are environmental things that can exacerbate it. So like lavender oil, tea tree oils, alcohol, marijuana, steroids, and certain prescription medications. So kind of looking to make sure that there's nothing that could be making the gynecomastia more. So behavioral changes. So these hormones don't just affect the body, they affect the brain. And so what I say is you got through the terrible twos, now you have to get through the terrible teens. Teenagers at this age or adolescents at this age, they can be laughing 1 minute, screaming at you the next minute, and then suddenly they're best friends again. So it's an emotional roller coaster, but knowing that this is completely normal and just trying to work with the kiddo to get through it. Some things that we're noticing, they have increased independence. They're getting older, they're developing more peer relationships, they're involved in after school activities, social events, going off to camps. And so just making sure that you're frequently checking in, hey, how'd that go? Open-ended questions, making sure you're knowing, where they are at all times. They're starting to move from more concrete thinking to abstract thinking. So, kind of their opinions of things is going to change. They're emotionally labile. Their amygdala, which is kind of the feeling part of their brain, develops faster than the prefrontal, which is the inhibitory portion of the brain, or the brain that says, no, don't do that. And so their emotions can they respond to their emotions faster than they can almost tell themselves like it's okay and calm down. They're more self-aware, so that can cause a lot of anxiety and stress. They're starting to develop some romantic and sexual feelings towards their peers. Some are engaging in risk-taking behaviors or being exposed to peers who are engaging in risk-taking behaviors. And the sleep cycle changes. I always emphasize to families that the sleep cycle changes are normal, as frustrating as they may be for a parent. Pre-puberty, body tends to get sleepy around 8 to 9, and that's based on when our body starts to secrete melatonin. As we go through puberty, this shifts a whole 2 hours later. And this is how we know, this is kids like to stay, or adolescents like to stay up late. And it's actually truly because their physiology is changing. The problem is we still recommend, and what's good for brain and body health is to get 9 hours of sleep at night. So kind of juggling that. And making sure, one way to help with that, increasing as much sleep as possible, is making sure there's nothing else that's causing them to not get enough sleep. So, are they staying up on their screen super late? Are they drinking caffeine or other stimulating substances? Peer pressure to stay out late. They just have so many demands now. Now they're going to school, they have more homework, they're involved in sports and clubs and activities. And so making sure time management is key. Don't spend 2 hours after school on TikTok and YouTube. That would be a good time to, maybe relax for a couple of minutes and then go ahead and start moving towards homework in bed. Frequent check-ins about peer relationships, really important at this age. One key thing, being a good role model, making sure that you're in healthy relationships. They learn best from what they see from us. So really kind of self-regulating too while you're monitoring theirs. And then frequently checking in with them. What was your favorite thing about today? What did you do? Lots of open-ended questions. We all know that if you ask an adolescent, did you have a good day? We tend to get those kind of yes, no, those I don't know answers. So as much as you can ask them open-ended questions, reminding them that, you don't need to have many friends, you need to have good friends. So it's one of those situations that's quality over quantity. And unfortunately, there are bullies, there are peer conflicts that happen, and helping them navigate those situations. Making sure that, self-image, talk a lot of self-positivity, body positivity, mind positivity, making sure that when they are doing good things, they are getting positive feedback to help build their self-esteem and their self-image. Monitoring their social media is huge. Things, we didn't have to deal with when there was no social media. Reminding them that people only post the positive of their moments of their life. And so trying not to compare yourself to what you see on social media, watching out for them being on inappropriate websites, any kind of bullying that can happen on social media. So keeping, if you do have an adolescent that's on social media, keeping close tabs on that. And then always talking about safety. Talking about sex. So a lot of times when you're talking about, menstruation, getting ready for babies, sperm production, erections, obviously that would lead into the conversation of sex. So one thing I tell parents, if questions come up, or if you're trying to initiate the conversation, a good first question is, well, what do you know? Because again, we live in the 2020 hyperspeed world. They've probably seen things online, heard song lyrics, so kind of knowing what they already know and building from there. And knowing that you are the best person to teach your kiddo about things. Studies show that parents who have regular discussions and teach their children about sex and safe sex, that they tend to become sexually active at a later age. And making sure that you cover the whole gamut. So what is sex? What are some of the risks? STIs, pregnancy, how to have safe sex, things like that. And I guess my final advice, communication's key. Make sure you set aside time to talk. We've all been to restaurants, we've all been to family gatherings where you see the people at the table, everybody's on their device, not really having conversation. So we have to make sure that you have times throughout the day, times throughout the week where you're having undivided attention, talking to your child. Again, open-ended questions are key. A lot of times the yes, no answer kind of, it stops the conversation. In engage in their topics of interest. A lot of times they might not be interested in things that we're interested in, Minecraft, robot, like things that I don't know about, but really investigating and learning about things that interest them, so that you have a conversation starter and things to talk about. And when you do have these conversations, don't jump to conclusions, hear them out. Why do you think that way? Why did you do that? What could you have done different? Kind of put our agenda aside and more kind of guide them within the conversation. And then we always talk about, this is a handout we have through IHA, what are the 5 basic parenting tips for adolescents? Love and connect. So love them, praise them, give them compliments, let them know how great they're doing when they're doing great. Learn about, appreciate, and discuss their interests. Lots of quality time. Quality time is key. Monitor and observe. So you need to know where they are. Again, they're becoming more independent. Where are they? What activities are they involved in? Know their friends, know their families of their friends. Because if other parents have concerns, they should be comfortable coming to you so that you can know. Guide and limit. So, there's going to be hard limits, there's going to be hard stops, but when you can, be flexible and kind of guide them, help them to choose the right thing to do. Model and consult. Again, model, they learn best from what they see from us. So making sure we're being good role models, in our relationships. And provide and advocate, let's make sure they have what they need. If we're ever concerned about a situation they're in, then we should, as parents, we really should advocate for them. And that's all.
Awesome. Thank you, Dr. Pollak. So if you have any questions, feel free to type them in the Q&A section now. There are a couple that I have here, so I wanted to start firing them off if you're ready.
Yeah, go for it.
Awesome. So looking back at acne, is there a point where your child may need like a dermatologist to step in, or something where over-the-counter medications just aren't doing the trick? And is that, yeah. Go ahead.
Oh, sorry, cut you off. Absolutely. So if you're ever concerned that acne is severe enough or it's bothering your child enough that you think that we're at that point, or if we, sometimes we'll notice during a wellness visit, does this concern you at all? There's actually a lot of prescription medications that your primary care physician can prescribe. We'll do things like topical antibiotics to decrease that bacterial load. Topical retinoids are something that help to break down and clear out those follicles. And then, there are other oral contraceptive pills, or hormonal therapy will sometimes help with that. If we kind of get beyond where your primary care, kind of the tools that are in our toolbox, then yes, dermatologists will help too. So yeah, I mean, if you're ever at a point where you're like, wow, these over-the-counter products are not working, bring it to your pediatrician or family doctor and let us know.
Okay, excellent. So I saw someone asked about a recording. So yes, we will share a recording of the presentation in the coming days. So check your email for that. Okay, so we talked about deodorant, and I know you kind of can start noticing it on kids. Even I think like with my kids, I think even at like 8 or 9, I felt like it. So I know that I've seen some kids versions of deodorant. Is that more appropriate, or is it okay to just jump right into the adult versions?
Yeah, so I would say it depends on like kind of symptomatology. They do make a lot of families are more comfortable with, and what I like for me, what I use for aluminum free,
Yeah.
which would be more like a kid's deodorant, but a lot of that would be family preference. But the kids' deodorants are perfectly safe. That's where I would usually start. Aluminum free is always a good way to go. But yeah.
Okay, great. And I know they do make adult versions aluminum free as well.
Yeah, they do. Yeah.
If the kid version isn't doing the trick, right?
Yeah. And much like our conversation about acne, normal sweat production, normal body odor is normal, but there are kids that have something called hyperhidrosis, which is like excessive sweating, that can lead to excessive body odor. So again, if you're at the point where you're like, wow, these over the counter products aren't cutting it, bring it up to your pediatrician, because we have other tips and tricks, other kinds of deodorants we can use.
Perfect. So we talked about shaving in both girls and boys. Now, what if you have a child that notices like hair like at really young age, like maybe 9 or 10? Is that too young to kind of start the journey into shaving, or
yeah?
Your thoughts on that?
Yeah, and again, it's not a one size fits all. It's not. A lot of it goes based on personal preference. If a kid that young in the family does decide to shave, then that really needs to be a monitored process. Personal opinion, I think that's young. But again, if that's something the family chooses for whatever reason, it just needs to be monitored so that we can make sure that they don't hurt themselves with the razor.
Perfect. So when it comes to, so it seems like there's kind of two talks that we have to have. So there's like the puberty talk, and then there's like the sex talk.
Yeah.
So when we talk to a younger girl about her body being ready for a baby, do we also throw in you're physically ready, but emotionally that's a different story? Like, how do you transition from the puberty talk to the sex talk, and do you do them at the same time, or is it okay to have some distance between the two?
I think it's perfectly okay to have distance between the two. And actually, I probably would. Because if you think about this from a young girl's perspective or a young male's perspective, it's a lot of information. And that's why I think those little chats and those frequent small discussions are much more useful than kind of sitting down, having an hour and just hashing it all out. So I would say, start with that. And then maybe, a couple weeks later, so what did you think about that? Did that bring about any questions for you? And again, there's so much in social media, on TV, on the radio, that sometimes that can trigger some conversations too. But I think separating it is actually more appropriate, reflecting. So we talked about this. Have you thought about that more? And that can kind of slowly lead in the direction.
Perfect. So kind of along the same lines, as I have a daughter and I have a son, but I know my children at a very young age would notice like pads in the bathroom if they would like come in and, while I'm getting ready for work or whatever. So is there like an age that's too young to like start explaining that? Or can you kind of dive in and say, that's for later in your life? Or, how do you do that? How do you manage that when it's a really young child?
Yeah. So, I think I would answer questions, again, age appropriate. I never really kind of steer away from the questions. If they ask it, we should answer it, in my opinion. But what I would say is, so that's something for when girls are older that they use, and kind of even leave it at that. Just very simple answers.
Okay, perfect. So along those same lines, so you're kind of talking about, you may have a parent who's more comfortable with those conversations than the other one. A father may not be as comfortable with his daughter. So how do you navigate some of those? So if a daughter maybe feels more comfortable talking to her dad, but he's not comfortable, are there ways to navigate that? Like passing it back to the mom if the dad isn't comfortable, or vice versa, passing it back to the dad if the mom isn't comfortable? Or should we really sort of like grin and bear it as parents?
Yeah. So the unfortunate thing is, I really say as much as you can, try to grin and bear it. Yeah. Because the more uncomfortable that they can sense us, we are an open book to our kids. Totally. The more uncomfortable we seem with addressing the topic, the more that's going to make them uncomfortable, and you don't really want to push them away from asking those questions. If a parent's more uncomfortable, maybe that initial conversation and, hey, I have an idea, and reverse that whole like back and forth that we talked about earlier with like brief conversations, journaling, things like that. But I would really say, the best interest would be to kind of grin and bear it and have those conversations and let them know that this is okay to talk about.
Yeah.
And then, The best way we all learned about puberty is we went through puberty. And so it may be that dad doesn't know what's happening to a little girl. Mom doesn't know. And so then we have to make the, ooh, you know what? I'm not so sure about that. We can look that up together, or dad might know, kind of direct it that way. But
Okay. And is it okay to say, I want to have this conversation with you. I do feel uncomfortable, just like you might feel uncomfortable coming to
yeah,
me. So it might take me a minute to, find the right words.
totally. 100%.
Okay.
I'm a mom. I said that with my kids, like, this is a hard thing for us to talk about. And I think that that's too where those little conversations kind of help, because you can kind of discuss one thing and then just move on for a little bit and then circle back to it.
Okay.
But it's 100%. They're going to sense that we're uncomfortable. So we might as well just let them know that we're uncomfortable. And this is a hard thing to talk about too, but that it's okay to talk about.
Okay. Perfect. So when we start bringing our children, as they're like moving towards the teenage years, is there a point where we should give them an option to meet with their pediatrician on their own in case they have questions they want to ask that maybe they don't feel comfortable in front of their parents?
Yeah. So every office has their different policy. Every pediatrician really has their different policy. I will say that most pediatricians, as kiddos hit adolescence, we do, it's almost like a double visit. Like, we'll do the visit with the parent and the child in the room. And then usually we ask for time alone with that child. And that way we can ask, do you have any questions about your body? Do you have any questions about social things that are going on at school? And then it gives them another opportunity. So most pediatricians will offer that, or most even family will offer that as kids start to hit adolescence.
Awesome. And there's so many books that you shared, which I'm personally grateful for children. Are there some books for parents that say, here's a great way to talk to your kids, that kind of take it from the parent's perspective?
Yes, I have one right here. So I use this, Parenting Through Puberty is a really good one.
Oh, awesome.
That is AAP, but it talks about everything: males, females, acne, growth. It covers the gamut. It's a really good one for parents.
Awesome.
I will be on it, like that. The kidshealth.gov one has a lot of really good information too for parents. It's written for at a reading level for children, but reading through it, you can learn a lot as a parent too.
Awesome. Sometimes it's nice to have their perspective too, the child's.
100%. Well, and sometimes honestly, some of the questions have been like, well, this is hard to talk about. But when you kind of read through some of those websites first, you could be like, oh, that's how they explain it to them. So it will help to give you some of the words and the tools.
Perfect. So I'm going to circle back to the question we talked about, the mom versus a female figure versus a male figure. So we have someone who's asking, they're a single mother. So do you have suggestions for them if they're not super comfortable starting a conversation with their son, or the son is not comfortable? Are there suggestions on what they could do?
So, I think in that situation, maybe a book, maybe the book and journaling, so that you can have some like indirect conversation with it to start with. That's where, I, as a pediatrician, have sometimes helped where I've had single dads with kind of, they've asked me before to have conversations with them, and we're perfectly comfortable doing that too. So I think using both those tools, use your pediatrician, use your physician, and then, maybe using a book, make sure you've read the book, you approve of the book, you agree with what's in the book, and then just little check-ins. Hey, do you have any questions? Things like that.
So I know you've said like the parents are obviously going to be the best resource. Is it possible to offer your child the opportunity to talk to a close family friend or a grandparent or someone if they maybe would feel more comfortable, like talking to a male versus a female?
Yeah, I totally, as long as it's somebody that you trust, they share the same values as you, and you start to talk about sex and sexuality and things like that, I think that that's perfectly fine.
Okay. And I'm going to circle back again to, we talked about the puberty talk versus a sex talk. So this person saying they had a period talk with their daughter but then the daughter watched a video at school, and she came home with so many questions, like, how does an egg get fertilized? Yeah. So at 10, how do you answer that if you're maybe not ready for the sex talk, or if you feel like maybe your child's not ready? Is there a way to kind of get around answering that without having the full sex talk at that moment?
Yeah, it's hard. So sometimes, when a man and a woman are in a healthy relationship, they can choose to have a baby. And I kind of just explain, like, it takes both of them, and that, the male makes a sperm, the female makes the egg, and kind of leave it at that. So I don't go into anything specifically super anatomical, any kind of talk about sexual intercourse, but basically just kind of the very basics of it. There is another good book for explaining how babies are made in younger kids. It's called It's Not the Stork. But that can help parents too, but just kind of explaining the very basics.
Okay, perfect. And then when it comes to behavior changes, or if you're noticing different emotions in your child, is there a point where, like, let's say you're kind of in between your annual exams, is there a point where you really should make an appointment to see a pediatrician, or look for that referral to a behavioral health or a therapist?
Yeah. So I think at any time, if there's any concerns, you can always address it with your pediatrician. Things that concern me, is this kids that are becoming very isolated, like they're wanting to go into their room, they're not participating in the activities that they wanted to do before, they're steering away from friends and family. If it's getting to the point where the behavioral changes are really affecting the family environment. So a lot of the changes we see, they're very stressful. Again, like they love you one minute, they hate you the next. But that there should be good times. There should be plenty of good times in between that. So if the behavioral changes are really affecting the entire family dynamic, then I would say something to talk about. And then looking at how they're functioning outside of the household. Like if you're noticing a dramatic changes in academics, their grades are going down, they're not interested in sports anymore. Again, like they're isolated from their peers. Those are kind of some red flags for me.
Okay, perfect. So last question. So if you have a child who's totally doesn't seem interested, or doesn't seem to be talking about it with friends, or isn't really asking any questions, is there a point where you should start the conversation yourself, and you have like a couple quick conversation starters?
Yeah. So, I would usually say, because we said 9, 10 years where we really start to see those changes. I really do think it's important to start having those conversations. And so simple things you can ask is like, hey, do you have any questions about your body? Hey, I've noticed that you're growing taller. Have you noticed anything else changing? Have you noticed anything changing with the people in your, like at school, or any of your friends? Have you talked about any changes? Just kind of general, again, those open-ended questions, because chances are they've thought and known about it more than we're aware. But yeah, I guess that would be my best advice.
Awesome. I know. And I love the idea of bringing in something like, I noticed you're growing much, much taller, as something that's like a little more comfortable to say as, I think, a parent, and maybe for a child to hear.
Yeah.
So I like being able to kind of like roll them in with those types of changes too. It's kind of maybe a little easier to jump into that conversation if you can start with tall versus menstruation. So, okay, perfect. I think that's it for our questions. Thank you so much for sticking around for a couple extra minutes, Dr. Pollak. This was an awesome presentation. I definitely took notes, and we will share that with all of our attendees in the coming days, again, via email. And then, yes, if you have questions, or if you live in the area of Orchard Pediatrics, Dr. Pollak, you are accepting new patients.
I am.
So feel free to reach out. We will share a link, as well as phone numbers in the email as well. So thank you again so much. This was an awesome presentation.
Thank you, everyone. Thank you for coming, guys.
For sure. Have a good night.
You too.
Bye-bye.